Hi, everyone. Today we're going to talk about diagnostic imaging and the tools that we would use and why we would choose one tool over another, depending on the patient health and depending on the situation. And there are several different kinds of diagnostic imaging tests that we could do. You guys know the classic X-ray. You've heard of a CT scan and an MRI scan. We'll go through nuclear medicine scans, aka bone scans, very briefly. And we already have talked about ultrasounds in this course, so we don't need to go further into detail for that. But when choosing in one of these particular imaging tools, we really need to consider a bunch of different factors, such as the speed and how quickly we need the images, the cost, the radiation involved. Some of these use radiation, some of them don't. The comfort level for the patient, any limitations for the patient to be able to get into the machine, and any allergies associated with the contrast materials that are used in the imaging tests. For example, an X-ray is a very non-invasive and relatively cheap way to be able to see very dense structures. You can see the dense structures here are going to appear very white, whereas the non-dense structures, like this cartilage in between the ribs and the intercostal muscles there, the X-ray will pass right through the body, right through those pieces there, and therefore will not be reflected back to the camera that is causing the X-rays to be uh, shown in white there. This would be really good for bone and teeth. You probably have gotten an X-ray either for a broken bone or going to the dentist. We can use them for lungs if we have inflammation and or fluid in the lungs. Mammograms use this all the time. We can use this for heart tissue, but you can see we would have to isolate the heart specifically in that spot. Blood vessels, if we're doing an angiogram, and the GI tract, all these things are more or less dense in the surrounding tissue, so they can be seen in an x ray. And so the advantage of this is that it's very quick, very painless for the patient. You probably had x-rays as a kid and didn't think anything of it. It's very non-invasive and it's relatively inexpensive. But the disadvantages might be that we have a small amount of radiation exposure in the patient because we are using a high um, wavelength of light to do so, when any high wavelength of light is technically radiation. And sometimes we use contrast materials to be able to see different things, like if we insert a contrast material into the bloodstream or into the GI tract, we can see the differences between the tissue and the material that we just injected, so we can see how things are flowing. But it might sometimes produce an allergic reaction, so you have to know whether or not the patient is allergic to those contrast materials you inject. A CT scan is something that you've heard of before, but you might not have seen one in person. It's performed in a large tube like this right here with a sliding table that the patient will lay on top of. And we're going to slide them in slowly through that tube. And the x ray itself is actually going to be rotating around the body, actually at very high speeds here. The machine itself doesn't rotate, but the x ray camera inside of it will rotate over and over, and each rotation will yield several images of the slices of the body so that we can see it from multiple angles. It's like taking an x-ray from 360 degrees. It's really neat. And so because it's like an x-ray, it is also non-invasive, and we can use it from many different angles to combine these cross-sectional images. This CT scan of the head was used to be able to get cross sections of each individual part of the brain, so we can see. Even here, we see the cross sections of the eyes at the end of the skull here. We can see the temporal lobes. We can see the frontal lobe. We can see the very top of the prefrontal cortex, and so on and so forth. And so this is really good for chest x-rays. This is really good for abdomens and the pelvis because we can take cross sections. Really good for the cranium. If we're looking for things that are not going to be really looked at with CT scans, it might end up being, like, for example, a lot of muscle tissue. If we were looking at, like, say, a blood clot in the leg, it might not be very worthwhile because leg looks like leg. So CT scans are painless and non-invasive, and most of the time they're very accurate because they contain images of lots of organs at once. You do have to have someone very specialized in radiology to be able to read these CT scans, or at least someone who is familiar with their specialty very well, like a surgeon with general surgery might be able to look at chest and abdomen CT scans better than most. But again, because it's a type of X-ray, there are limitations that we have for radiation exposure and the contrast materials possibly being causing an allergic reaction. So next up is an MRI scan, and these are much bigger machines. They take up entire rooms pretty much. A much larger tube, but you can notice that the space itself is much, much smaller. So this is a problem for individuals that are morbidly obese. They might have trouble actually fitting in the tube, as well as individuals that get claustrophobic. They do have a problem actually uh, being calm in the tube itself. But we slide the patient in just like before, and this time around, there's actually a rotating magnet that's turned on and off over and over again that causes uh, the particles inside of the body to actually align, which is really neat because then when we send radio waves through, instead of high intensity light waves like radiation, these radio waves are going to bounce off of these particles at specific directions and create this computer image that's really fascinating. So it's using magnets to align things so that the light reflects the radio waves, I should say. It is a type of light, but the radio waves to reflect off it in a certain way. Much fancier science than I'm used to. And so magnetic resonance imaging, MRIs, actually produce something like this, where we can actually see where high amounts of energy are used in specific spots. Not just the density of the tissue, but the energy inside the tissue. It's similar to a CT scan, but there's no ionization in terms of radiation, so it's completely safe for a patient. And we use this a lot for brain and spine and joints and abdomen and blood vessels and pelvis because these are all tissues that might have more trouble with cross sections like CT scans, not being as defined, but still needing to have cross sections to be shown. Now, the advantage of this is it's completely painless and it's even more non invasive than the other techniques that we've had. The soft tissue is going to be nice and clear, and there's going to be no ionization radiation. The contrast materials are sometimes used uh, are less likely to give the allergic reaction. That's not no allergic reaction, but they're less likely to. Um, but the problem is if this patient has any implanted medical device that could malfunction or break the machine because it'd be magnetized to the actual machine itself, we would not be able to get this patient an MRI. And any slight allergic reaction risk is going to happen with the contrast material. You just have to know what material you're putting into the patient and uh, um, if they're allergic. And like I said, it's a very confined space. So individuals that are morbidly obese, over 300 pounds, I probably could fit in, but people much bigger than me probably could not. And claustrophobic patients or anxious patients really have a hard time with MRIs. This last one is a nuclear medicine scan, also known as a bone scan. What we're going to do is we're going to inject a small amount of radioactive materials called tracers, also known as nuclides, to the patient's bloodstream. And when it gets in the bloodstream, it's actually going to go find the calcium deposits in the bones and it's going to attach to them. That way, we don't have to have a contrast material, and we can actually just lay the patient on top of the scanning process itself and allow the camera to go back and forth over it. We don't have to stick them in a tube or anything. It is slightly radioactive, including the actual light used as gamma radiation. So it is something that should be considered uh, dangerous if you do it over and over and over again. But it is non-invasive and it's going to produce 2D images of the bones specifically in pretty good contrast. Because of this, the advantages we have is that it can scan the entire skeleton all at once. It's extremely sensitive to abnormalities. We can see the abnormalities in the pelvis right here, and the variations in bone metabolism since it's attaching to the calcium deposits, and bone metabolism is all about how much calcium is being deposited. You can see how dense the material is at specific spots where the bone calcium is the most deposited. The disadvantages, of course, is that there is a small amount of radiation and it can't determine the actual cause of the bone abnormalities. We would still have to do some other kind of imaging to really look at what's going on specifically with that bone itself. But it's a good way to figure out exactly where we might have, let's say, an osteosarcoma, a tumor in a bone. We can see exactly that that would be in the pelvis right here, so we can take a look at it using a different imaging service. Thanks for listening. Let me know if you have any questions.